Hi, everybody. I'm Dr. David Gross, and I am a psychiatrist.
And I'm Dr. Andrew Rosen. I'm a psychologist, and welcome to Two Shrinks and a Mic.
Today, we're going to continue a discussion about a very important topic, and that is trauma syndromes. And it's very important because, unfortunately, many of the disorders that are currently being treated in the mental health clinician's office, whether they be depression, anxiety, eating disorders, substance abuse, relationship problems, etc., all often have a major component of trauma behind it. And unfortunately, the traumatic and trauma itself does not get addressed as well as it should. So today, we thought we'd begin to talk about aspects of treatment. Unfortunately, the treatment for trauma is not as straightforward as the treatment for anxiety or depression, relationship problems. And part of that is because trauma has evolved over the years. Way back in the days of Freud, the belief that there was a psychological component to it primarily, and psychoanalytic in-depth therapy was required to treat it. We now have better understandings as to the cause of trauma, and fortunately, treatments have also developed. But I must warn you that we're still in a development stage in better understanding the treatments for trauma syndromes.
And one reason for that is the definition of trauma. I think the vast majority of people, if you ask them, have you ever been traumatized or gone through trauma? Most people would say no, because they don't realize that there may have been trauma in their life, but because they have heard the word trauma, they think of the big kinds of trauma, trauma with a capital T, such as being in a situation where there was a murder or a war or some kind of tragedy or natural disaster. So it's important to ask people, when you ask them, have you ever gone through trauma, to really give them a better definition of what trauma is. And what I do is sometimes ask people, what's the worst thing that's ever happened to you in your life? Or maybe even give me in your memory 2 or 3 things that you would say, boy, that was really a very upsetting thing that happened, or that was a tough time for me, or that was an event that was really difficult to go through. That could be defined as trauma. And if you can kind of incorporate that into the picture of what trauma is, then you open up a lot of possibilities for treatment. Whereas before, you might just see a person who said they were depressed or anxious and never really touch on their history of trauma.
At our last podcast, we talked a lot about the symptoms of trauma syndrome, post-traumatic stress disorder, and also talked a bit about the brain. So if you did not see the previous podcast, I'd urge you to look at it because it provides you with some important information. And the biggest piece of information and what has made the treatment of trauma problematic is we now recognize that traumatic experiences are stored in a part of the brain, as we mentioned last time, and is held on to very tenaciously. And those emotions, visual experiences, sound experiences, smell experiences are recorded there in that part of the brain, and they're ready for playback. So anything that brings you back to a similar situation as what occurred during the original trauma can lead to the playback of those powerful emotions and feelings. And so because of that, we now recognize that the treatment has to focus on helping to empty out those negative engrams. Engram is a memory that gets stored in the brain because they can last your whole life. And, to this day, you can have Vietnam vets or even World War II vets who will have trauma resurgence and wake up in the middle of the night with horrendous trauma nightmares, or have a startle response during the day in response to a car backfiring. And so a lot of the treatments now are geared towards the trauma memories and experiences that are stored, and the bulk of the treatments are psychologically based, and that would bring us to your expertise.
So when a person has a fear or something is very upsetting or scary, they tend to not want to think of it. They tend to run away from it. They tend to want to not ever have that on their mind. And that's the same thing with trauma. And these engrams in our memory, if they do pop through, they're so upsetting, so frightening, so difficult because of the emotion part, that the person tends to want to run away from it and not think about that, not think about what happened in that event, not remember it at all. I don't want to remember painful things. I don't want to remember traumatic events. But treatment actually requires the thing that we do normally when we're afraid. If a child's afraid to ride a bike or a child is afraid to do something, as a parent, what do? We have that child keep trying, gently encouraging him to try to do that thing or challenge that event. And little by little, the child is no longer afraid of it. It's the same basic principle with trauma. If trauma memory first occurs, it's attached to fear. Somebody once described it as like if you, in the old days when you wanted to make ice, you put water in the little ice tray and each section has a square and you put the ice, the water in the freezer and then X number of hours later it freezes. But if a little bug got in one of those little cubes, it would stay in there until the ice was melted. Very similar to what goes on with trauma and memory. It stays frozen until something triggers the memory. And then there it is, not only the memory, but the emotion that came with it. So what we try to do with treatment, psychological treatment of trauma, is get the person to remember over and over and over again and experience the emotions until the emotions are basically gone. So the fear is no longer attached to it because now the brain realizes that was then and this is now. It's no longer. It's a difficult process. It's hard for a patient to go through, but it's the way we do it so that bad events, bad traumas remain in the past and in the present are not attached to painful memory and emotions.
And that process is called extinction. We know that from old-fashioned classical conditioning, Pavlov's dog, et cetera, that you can have a behavior that's been built in, but if the behavior no longer gets a reward, it extinguishes. And so if a person has been in a traumatic holdup and traumatized by it, we teach them techniques to calm their body, calm their brain, slow down their thoughts, slow down the heart rate, learn meditation, mindfulness ahead of time. And then when they get exposed to similar situations, and a lot of the work that you've been doing on virtual reality therapy allows somebody to actually put on a pair of goggles and have that experience of a holdup. And eventually the circuitry that got developed in the brain will extinguish and no longer be active. One of the things we've learned in recent 10, 15, 20 years of neuroscience research is that the part of the brain which is deep in the brain that holds on to these memories can be away from consciousness. In fact, the psychologist named Joe Ledoux was the first person to demonstrate that the unconscious may be kept in that part of the brain. So it's not just the, I don't want to think about it, I don't want to experience it aspect of it, but that part of the brain actually can be separate from consciousness. And it's only when people oftentimes, for example, in therapy, after being in therapy for 2 years, suddenly the memory comes back. And it had been kept quiet and hidden for so many years, and boom, it's back in full force. And so the treatment requires a two-step process. The first step is to let somebody know that they can be safe in the environment. We talked last time about how to deal with major mass catastrophes, and first thing to do is to make the person safe and secure and know they're now okay and they're not in danger anymore. Then after the fact, over time, you can get them to tell their story and talk about it. And so the first stage has to be learning the techniques for self-calming, self-relaxation, so that you feel like you have the ability, if you begin to get activated when you talk about the traumatic episode, that it's not going to push you over the edge.
Human beings, we're all the same. We don't like feeling pain, and we certainly don't like remembering pain. The good news is with real physical pain, you can remember it. You can remember it was bad, but you can't re-feel it. The thing with trauma pain, you actually can re-feel it, and that's what's so difficult about it. But, I like to divide trauma into two categories. Trauma with a capital T, which is typically what will get people to come for treatment, because the type of trauma they had can be so devastating, so severe, that they get the kind of symptoms that, we've talked about, the flashbacks, the feeling of being out of control, the real severe reactions that can occur even many years later after trauma with a capital T. They're motivated to come for treatment because they're in such pain, and they understand where it's coming from many times. But the trauma with a little t isn't so clear to people as to, like I was saying before, that it really is trauma. So if a person has trauma, let's say in relationships, they were exposed to issues of maybe emotional abuse or neglect, for example. Now that person may not be experiencing, the severe reactions of trauma, but they may experience more subtle ones, like, how come I can't trust anybody? How come when I'm with people, I kind of clam up, I close off? They may not realize that that's associated with trauma, and even their mental health professional may not realize it was connected to trauma. Maybe they just think, well, you're just not a trusting person. But maybe for many people, the mistrust and even severe mistrust comes from trauma with a small t. So I think over the recent years, we've learned that, there's two types of trauma therapy. There's for the severe type, and then we have to go be more aware of the subtle types that come into our office that may not look like trauma, but they really are trauma.
Over my career, I've been convinced, since I see a lot of folks with trauma, as I mentioned in the last podcast, that trauma over a long period of time, that even though it may be with that small t and a much lower level of intensity, can be more problematic than somebody who develops true post-traumatic stress disorder, because the subtle influences are there, as you indicated: relationships, trust, alcohol use, marijuana use, anything to self-medicate, the pain that a person's not aware that's being generated in their brain, but the pain is there nonetheless. So that type of persistent chronic trauma of a overly critical, controlling parent, for example, over years, would not meet the criteria for, I think I'm going to die. But, a young child in those kinds of situations with a alcoholic parent who's angry and loses control or is overly critical and difficult, that itself is quite traumatic, and it requires treatment. And unfortunately, the medications we have are not as effective as we hope they would be. There have been a few medications that have been FDA approved for trauma, but unfortunately, I don't put too much stock in those trials, because the placebo response is always very significant. And placebo, although real, doesn't mean the medication's working. It really means that the person's trust in the clinicians and the treatment program they're in has been very powerful. But the tendency with medication is to really address physical symptoms and psychological symptoms. So, for example, if an individual has sleep difficulties, then there are medications that can improve sleep. If they're having trauma nightmares, there are very specific medications that can be helpful for that. That I've had some good trials, although there are trials that have not been as good, and so none of it is a gold star, so to speak. The use of antidepressants can be helpful for ongoing depression. One of the theories about trauma syndrome is that the flight or fight response gets activated when you're faced with a horrendous situation, and the part of the brain that controls that is partly involved the autonomic nervous system and some of the higher centers. There are medications like beta blockers that can help that, and there's some studies that have indicated that individuals who are on beta blockers at the time of a traumatic experience have less risk of trauma. One of the theories is that the fear response gets involved in the brain and embedded in the brain, and is very powerful. And if you can prevent that fear response from being an engram or a memory, and beta blockers can sometimes help that. Some of the research on the use of beta blockers after traumatic experience is not as impressive as one would hope. Generally speaking, when I have somebody who's had significant trauma and needs to have treatment, I refer them to a therapist who understands trauma and has been trained specifically in many of the modalities of psychological trauma treatment.
Think about what's going on today in the media, talking about kids who are on social media and very often end up being emotionally bullied and really suffer. That's trauma. That's trauma. And it's very strong. It's very powerful. And think of it, it's at an age when children are so susceptible, including in their nervous systems. And on top of it, because of the type of abuse it is, very often it's hidden. They're so ashamed of it that they can't tell anybody that they've been traumatized. Most people, if they're going through trauma, will mention it to somebody, or it'll be visible to somebody, or other people will be aware of it. Oh, this happened to you, or that happened to you. That's too bad. But children, teenagers, if they're being emotionally abused on social media, the trauma is hidden on top of it, which I think explains why sometimes you hear such tragic stories of children attempting suicide or even committing suicide, because the trauma is so painful and they can't tell anybody about it, because having been abused, emotionally abused by other people, is so embarrassing to them. So I think when we talk about treatment for trauma, this is going to be a huge area that I think people who work with kids and just even adults, because, these kids grow up to be adults, it's going to require a certain type of trauma therapy that maybe is different than the traditional types of trauma that people have been used to talking about.
The goal is to reprocess the trauma, as we mentioned before, so that that circuitry that got created in the brain no longer is active. Mentioned this a number of podcasts ago, but there was an interesting experiment done by a psychologist by the name of Peter Levine. He went to Africa because he was curious about animals that survive a predator. So that if you have a springbok who is chased by a lion or a tiger and escapes, you can imagine how traumatic an experience it's got to be, whether they've been clawed or just had to run away. And what he did was he followed these animals who escaped the predator and found that they went off quietly and would shake all over until they calmed down. And that aspect of a physical relief got him thinking about treatment for humans. And he developed a treatment program called somatic experiencing therapy, which is used to this day, where the goal is to get individuals to experience the physical symptoms that they went through when they got traumatized, or during the periods of time that they were traumatized. Again, letting them know they're in a safe place, letting them know that they've been taught the tools to calm their brains and to calm their bodies. But it's almost like you experiencing the physical symptoms again and realize that the sky hasn't fallen or the earth hasn't swallowed you up is tremendously therapeutic. And some people practice that form of therapy. There are other more sophisticated reprocessing techniques that are used. One of the more recent ones is EMDR, which stands for eye movement desensitization reprocessing, which sounds hokey. And initially when I saw the technique, I thought it was really hokey, because you get people to get stimulated either in both eyes, or get auditory clicks in both ears, or tactile sensations in both arms or hands. But what we believe is what happens is the brain actually gets stimulated on both sides of the brain, both hemispheres of the brain, and that serves to help disinhibit the stored emotions and memories that are deep down in the brain. As I indicated, before doing that, you have to spend a good bit of time getting prepared with the relaxation techniques, meditation techniques, self-calming effects, because if you're not careful, you can open up a Pandora's box. And my advice to everybody is that if you're going to go for specific trauma therapy, whether it be somatic sensitization and re-experiencing, or EMDR, for example, that the individual has had lots of experience with it. A person can take a course for a weekend and suddenly say they're an expert, but that's not the case. You really have to have, you want to go to a heart surgeon who's done many, many procedures, not a heart surgeon who does 1 or 2 every month to get the best result.
And there's another complication there as well. There's 2 complications. With more and more discussion about trauma, it's become more in vogue for people to say that they treat trauma, and for people to go for this type of treatment. So as you were just saying, David, it's so important that if you take the step to go get trauma treatment, that you really know that the person you're seeing, really, that's what they do. They know trauma inside and out, not somebody who, like you say, just treated it a little bit or learned a little bit of a technique. Trauma is a very serious issue. And the other piece of it is that when you go for treatment for trauma, it's kind of different than other reasons that people do go for treatment. And sometimes, and this is a real big complication, I haven't seen so much of it lately, but people start to remember things that may or may not have actually happened in their history. And we used to call, years ago, we used to call certain memories called screen memories, that sort of like when you have a dream where, it seems like you're remembering something, but maybe did it really happen that way? Or deja vu, another type of experience. So sometimes if it's not really handled well, certain memories about trauma can occur and they really maybe didn't really happen. So it's complicated. It's not so simple as just go get a little treatment for the trauma and you'll be all better. And usually trauma is associated with other symptoms. So it's something that can be treated. It's very important to treat it if there's been trauma. And it really can open up the door to a lot of positive future in everybody's life.
The other aspect of attending to trauma, I've seen many, many times where, I'm treating a woman who's been exposed to molestation, sexual abuse, either as a child or in problematic relationships, who now is in a good marriage with a caring husband or spouse, and that spouse is saying that, well, we can't be intimate, can't get her, be trusting me, always seems to be suspicious. And that's where bringing the family in to help them understand, because it's very hard for people to understand the impact of trauma. I mean, it's hard for mental health clinicians to understand it because it's not as black and white as panic attacks or depression, and not as clear cut, and it's much more subtle. But to have a spouse understand the nature of the disorder, the fact that it can be treated, and it's also a mind opener for the individual who's the victim, to recognize that, gee, this is not my fault. This is what's happened to me because of my experience. The other aspect of it that I see all the time, unfortunately, is individuals who have what was believed to be a primary substance abuse problem go into rehab, get treated, and then relapse right away. And the trauma itself was never recognized and treated. So people have to understand that this may be a slow process. You really can't treat somebody who has an active substance abuse problem with trauma therapies. They have to get cleaned first, and the brain has to heal from the substances and get cleared out from the effects of the substances. Then the next step is to go for trauma therapy. When trauma syndromes are very, very severe, sometimes it's necessary for individuals to go into a residential program that focuses on trauma. They need that amount of time, but they also need to feel like they're in a safe place, that they don't have to feel embarrassed or feel like other people look down on them, that they're in a warm, helpful environment where they can rid themselves of the bugaboos of trauma and learn the techniques to get control over it.
I think there's also an expectation sometimes from people who are with somebody who's been through trauma to, sort of say, well, how come you're not over it? That happened 5 years ago, or I'm not like that person, or that's not what's going on now. You have to realize where you are now and get over it. And so there's a kind of a lack of understanding as to how difficult it can be for people who have been through trauma to not live in the past or to not be afraid of the past reoccurring. And so you're right. Couples therapy, family therapy really help other people not learn to just, kind of be okay with it, but learn how to help the person who's been through trauma.
The other message that comes out of all of that is this is nothing to be ashamed of or to keep as a secret. It doesn't mean that society is going to look down on you. If anything, the goal is to make it more real and something that is not uncommon and can be addressed. And so with the proper treatment, individuals do get better. The goal really is to help somebody recognize that that's the case. And that requires getting a good history, really asking the questions you have to ask to find out if there's been trauma. Because most people are either not going to remember it or they're not going to want to talk about it. And I've been just amazed how at times an individual's been in therapy for a year, and when I saw the person in consultation because of the therapist thought that medication could be helpful for their anxiety or their depression, and when I get a history, I'll find out that they had significant traumatic experiences. And the individuals say to me, you're the first person to ask me those questions. And so it's really important to be on the lookout for it, because sadly, it's much more prevalent in our world than we realize, and it needs to be addressed. And with the advent of social media and bullying online and number of likes on TikTok and Facebook and all that stuff, it's not an easy world out there if you're growing up, and we need to be sensitive to those aspects of it.
So with that in mind, I think what we want to encourage people is to realize that there's different types of trauma, and just because it may not measure up to what we used to talk about as being trauma, if it was upsetting for you, if it was a difficult challenge for you, it may have created some trauma with a little t, and it could really be helpful for you to get treatment for it, or at least to explore whether or not it's worth getting treatment for it, and being able to leave it in the past at some point and look forward to a better future.
With that, let people know that there is hope. We don't, in no way do we mean to suggest this is an impossible prospect. It's not. And with that, I'm Dr. David Gross, psychiatrist.
And I'm Dr. Andrew Rosen, psychologist. And this has been
Two Shrinks and a Mic.
We'll see you next time.
Bye-bye.
Bye-bye. The Two Shrinks and a Mic podcast is for informational and entertainment purposes only. The views expressed are those of the hosts and guests and do not constitute medical, legal, or professional advice.
Please always consult a qualified healthcare provider before making any medical or wellness decisions. Our content is not a substitute for professional medical guidance, even though our mothers tell us we have the best advice possible.